A new study is looking at disparities in what's called bystander CPR survival rates, specifically for women and Black Americans. And Dr. Darien, I'll break down what we're learning about the subject.
So CPR is one of the most important things I think everyone should know. And from this new study, we unfortunately realized that there are some real disparities that we have to pay attention to. When they looked at the overall numbers, CPR survival rates for everyone tended to increase, but there's a problem called the survival gap, which is where we have Black individuals and women having lower survival rates compared to their white counterparts, and men had higher survival rate than women overall. Now, this is a concerning sign, likely associated to multiple different things and also nuance when you think about the emblematic, implicit and explicit bias that exists, but also I think it's really just a lack of education in communities of color also about how to properly do CPR.
And we're talking about CPR outside of the hospital, obviously.
Yes.
How do we work to close this gap?
We start with simple education. I brought some CPR dummies here for you.
Okay.
And I wanted to teach you about basic things about CPR. The first thing, don't panic. The second thing is that CPR, anyone can do it. It doesn't take a formal class, and of course, I think that everyone should do it. So if you notice that someone is on the ground, you're going to kneel down, you're going to shout and scream, try to get their attention. Are you okay? Are you awake? You're going to notice that they're unconscious. You're going to ask someone to call 911, and you're going to ask someone else to grab an AED, an automated external defibrillator. Next, you're going to bend down, and you're going to listen for breathing. That often involves tipping their head forward and just listening for breathing for about 10 seconds. I speak out loud when I'm doing CPR and resuscitation to let everyone know, so I say out loud, person is not breathing, and now we're going to begin CPR. You're going to take one hand and put it in the middle of the chest, right between the nipple line or where the nipple should lie. The other hand right over it. You're going to lock your elbows and bring your shoulders over the chest, and you're going to use your weight of your body onto the chest to compress down 2 inches. The goal of CPR is to pump blood through the heart. And so as you're pumping down 2 inches, you want to make sure that you let up enough so that the chest can normally expand to allow the heart to fill up. And the rate, you're going to do it at about 100 to 120 beats per minute. Everyone uses a different song.
Staying Alive?
I use Staying Alive. So, Staying Alive. That's as much as I think I can sing about that song. So you're going to continue this, and this is hands-only CPR. A lot of us learn CPR from using our breathing. Right now, hands-only CPR is easy, it's effective, and it's as effective as regular CPR with breathing for the first few minutes while you wait for
And is there such thing as pushing too hard?
I was just going to ask that.
That's a great question. A lot of people get afraid. One thing you have to remember is that anything you do is going to be better than nothing. If someone's heart is stopped, you're not going to be pushing too hard. A lot of people fear they're going to hurt the person. If someone isn't responding, anything you do is better than nothing.
Is this same for a child?
It's different for a child.
Okay,
Great
we can
question.
go into that at some point.
Yeah, with a child, you usually use one hand, but just in general, I think it's important to remember hand over hand, locking elbows, shoulder over chest, and press down, Staying Alive. You got it?
We have done so many stories where it truly has saved people's lives.
I'm telling you, when I get a patient into the ER, and I'll be in the ER later on, when I get a patient, my first question is, when did CPR start? CPR outside in the field triples, sometimes doubles and triples patients' ability to survive. So
I got a red light, so does that mean it worked?
I didn't know it lit up. Good to know. I got to check that.
Okay. Thank you, Dr. Darien.
Thanks, Dr. Darien. And for more on how to save lives using CPR, check out the American Heart Association.
This is so important. Yeah.